When the first COVID-19 vaccine was approved late last year, a wave of hope swept over the world for the first time since the coronavirus outbreak was declared a pandemic. But as South Africa waits for the first batch of vaccines to reach home soil this week, some are skeptical about its safety and possible side effects, and questioned government's rollout plan. We spoke to healthcare professionals to get their views.
Taking the vaccine, you can put me in front of the line. I'll go to the front of the line. My concern is more in terms of the rollout, because that is the most important factor that will determine whether or not it's going to be successful. If the rollout is bad, I mean, by the time we start injecting more and more people, will be in the middle of the third wave, and then you might feel like it was ineffective. So the most important thing right now is the rollout. In terms of the safety of the vaccine, I'm 100% certain that it is safe. You know, there are many hurdles that need to be that scientists need to go through before they can say, hey guys, here's a vaccine.
Receiving the vaccine will help us, will ease our anxiety, because then we will have some sort of immunity against the virus and will be able to nurse our patient to the best of our abilities, because now we are facing this thing head on. It saves us a lot, and we won't lose even more healthcare workers to this virus. With regards to the vaccine and the public being skeptical about it, I think the skepticality comes in fairness. It does not come in saying they refuse, but the people in the public want to have information, want information disseminated to them, verified information, and not information that leads them astray or fails them. So I just would urge people to just inform themselves and be able to make a decision, and for our government to make the information known to the people. COVID has exposed our healthcare to what it has been, and it has made it worse. So getting the vaccine will ensure that we are able to at least get back to where we were, and to at least improve where we need to, because it is needed.
I strongly feel that it will provide quite a bit of hope within the healthcare workers, and every single healthcare worker I've spoken to who will be getting the vaccine can't wait. I also feel that once the healthcare force is vaccinated, and at least let's hope like 2/3 of them, your staff levels will be better, and which will help with morale and all of that. In terms of people not wanting to get the vaccine, obviously it's an individual choice, and it is based on fear, on anxiety, on fake news, on social media. My message is, please just listen to the science, and remember that we've been vaccinating people for many, many years with many different vaccines which have been proven to work. But obviously people have the right to decline it, but I can guarantee you there's going to be 10 healthcare workers behind them wanting that vaccine.
Unfortunately, we need a much bigger number, which I don't know when we're going to achieve that type of percentage that we'll need to change the face of COVID in our country. But hopefully, it will protect the healthcare workers so that at least they can, we won't lose many more.
If this situation is unpacked and laid flat on a table, yes, you would find that the real center or cause of things is COVID. But will a vaccine cure burnout? Will a vaccine cure fatigue? Will a vaccine erase the traumatic experiences of just feeling like you're working in a morgue? The only thing that the vaccine could do, and this is not even a factual, is just stopping the virus, the spread of infection, which could as well lessen the amount of patients in the unit. But remember, the challenge wasn't necessarily the patients, but rather staffing. One nurse is allocated for 5 people on ventilators. Never even heard about nurses going on training for the vaccine. I do not know who's going to administer this vaccine on who. How do you use a drug that you do not know what it does to the next person? But we need to remember our primary sources of information are not giving us confidence to believe in this virus. How do you trust someone who couldn't supply you with gloves, masks, just general PPE? How do you trust them to be able to supply you with a vaccine that will work? Other countries in the continent of Africa, healthcare professionals were relieved of tax. Our government is opting to bring up the tax, the very same tax of the person that has been overworked due to this virus. You bring up their tax because you now want to purchase a vaccine that you're not even sure if it's going to work and give it to them.